Hey, good evening, everybody, and thank you for joining us for another bi-monthly online Zoom educational session of Heart Support Connect, hosted by Heart Support Australia. My name is Dr. Christian Badicchio. I'm the CEO of Heart Support Australia. And tonight with us, we have a bit of a change in our lineup. Dr. Sarah Gauci, whom I'll give a bit more of an introduction soon, but still following along the lines of heart disease, mental health, or I should say cognitive impairment, if I'm correct. So it'll be a very interesting talk today for consumers, but also clinicians within the cardiac rehabilitation space, seeing patients and consumers across the country. Obviously, I'd like to just have a brief context in terms of what's been happening with Heart Support Australia since we last hosted this Heart Support Connect. Understanding again, the work that we're doing across Australia and around peer support, stopping to try and stop secondary cardiac events and improving the lives of those living with heart disease in Australia. But in particular, our peer support group network now since January has nearly tripled in sizes. We have gone from having 10, 11 peer support groups now having 25. And we're thankful as of November this year, which we've finally locked them in and just working towards launching. We'll have groups for the very first time in Northern Territory at Alice Springs and also Northwest Tasmania between Burnie and Devonport, which means now for the first time ever in Heart Support Australia's history, we'll have a location in every state and territory for the very first time. And obviously, it's increasing in our trajectory in terms of having significant coverage across Australia, not just in regional Australia, which is still continues to be a strong focus of ours, but also in metropolitan areas. So stay tuned for more information. And like always, if there's any more information that you would like about Heart Support, you can feel free to email us at office@heartnet.org.au, give us a call, or even go on our website, which has all of our latest information at heartsupport.com.au, or you can follow us on Facebook, Twitter, and LinkedIn. But enough about that. I think everyone kind of knows about that. Tonight, we have a very amazing speaker, Dr. Sarah Gauci of Deakin. She's within the Solve CHD team under Professor Julie Redfern. She's a research colleague of mine as well, I can say. So, and has thankfully come in at last minute due to the illness of our planned speaker, Dr. Clive Swat, who I'm sure will be with us sometime in the new year when we redo the calendar list. So I'd like to introduce Dr. Sarah Gauci. She's a behavioural scientist with a background in psychology. She completed her PhD at the Centre of Human Psychopharmacology at Swinburne University of Technology. Her research explored how dietary patterns and cardiometabolic risk factors are related to cognitive performance in middle-aged and older adults. Sarah's current research interest is in exploring interrelationship between cardiovascular health, lifestyle, and mental health. The Solve CHD program will explore how lifestyle interventions can be used to improve the experience and quality of cardiac rehab for patients with comorbid mental health and cognitive issues. There's a lot there. She has a bright future ahead of herself. And on behalf of Heart Support Australia, consumers and our cardiac rehab clinicians across the country, and those who probably watch this afterwards as well via YouTube channel, welcome and thank you for being our guest speaker tonight.
Thank you so much for having me.
All right, so without further ado, I will switch over to your slides now. I will make you the host and you can go from there doing your very, very special thing. Don't forget to make me host back after when you finish.
Yes. Okay, let me just check that I can share my screen. Share. So can everybody see the slides okay?
Perfect.
Awesome. All right, well, thank you so much for having me here today. I'm very happy to present on this topic that's very close to my heart and something that I've been researching for a number of years now, looking at the role of mental health and cognition in heart disease. And I just want to say I really appreciate the stuff that Heart Support Australia does, with peer support being a really important part of recovery of after a heart event. Before we start off today, I'd just like to acknowledge the traditional owners on the land from which I'm presenting today. For me, it is the Wurundjeri people, and I'd like to extend my respect to all Aboriginal and Torres Strait Island people. I'd also like to acknowledge the collective and expertise of those with the lived or living experience of mental ill health, and those of us who have loved and care for people with mental ill health. So as Christian said, I'm a sole CHD researcher working at the Food and Mood Centre at Deakin University, and I'm funded through Solve CHD. But today I'll be presenting on some work I did during my PhD, as well as some of the work I'm doing now as part of my postdoc. So something that I think is really important in recovery after a heart event is mental health. And mental health includes our emotional, psychological and social well-being. And it impacts the way we think, feel and act. We know that mental health has an important relationship with heart disease in that it has a bidirectional relationship. That means poor mental health increases the risk of developing heart disease or cardiovascular disease. But we also know that heart disease increases the risk of developing poor mental health. So this makes the relationship between mental health and cardiovascular disease quite complex. Oh, sorry, it's got a bit of a timer on my slides. So following a heart event, we know that poor mental health is common. And in the first 4 weeks after a heart event, many patients, about 75% of them, experience what is known as cardiac blues. And I'll talk a bit more about cardiac blues in the next slide, but it's just the emotional changes that one experiences after a heart event. And luckily for many patients, cardiac blues dissipates within the first couple of months after their heart event as they go onto the track to recovery. However, for about 1 in 5 of these patients, they go on to develop major depressive disorder. And this is really concerning because major depressive disorder increases the risk of secondary events, readmission to hospital and mortality. So we really want to be able to improve the mental health experience of people after a heart event to reduce their risks of secondary events and poorer outcomes. So within the first 4 weeks after a heart event, patients often experience the cardiac blues. And data from the Australian Centre of Heart Health suggests that it's about 75% of patients who experience cardiac blues in the first month or so after their heart event. And the cardiac blues just describes the changes in emotional experiences after a heart event. So things like anxiety and depression are common, but also changes in emotions like shock, denial, worry, guilt, anger, sadness, and also relief that you've had a diagnosis and that you're on the road to recovery. As I said, for many of patients, these symptoms do resolve over time. However, for about 1 in 5, they go on to develop major depressive disorder. And the prevalence of people that have subthreshold depression, so people who aren't quite clinically depressed, would be even higher than that. So we want to be able to improve the mental health of people, of all people after their heart event, not just those with clinical depression. As I said in the first couple of slides, that mental health and particularly depression and cardiovascular disease have a bidirectional relationship. And this diagram from Gold et al. Really describes how that bidirectional relationship occurs. So I don't know if you can see my mouse, but we have depression that increases the risk of a medical disease. In this case, it would be cardiovascular disease through various pathways. The first one being health behaviours. So we know that people with depression are more likely to have a poor diet and participate in health behaviours that increase their risk of cardiovascular disease and other medical diseases. There are also biological pathways that increase a person's risk of cardiovascular disease, and one of these is inflammation. There are also side effects from certain antidepressant and antipsychotic medications that have cardiometabolic side effects, which increases the risk of a heart event. In the terms of how cardiovascular disease increases the risk of depression, we know that there are also some pharmacological side effects. There are biological changes. So cardiovascular disease, for example, can cause neurodegeneration in the brain. So higher blood pressures and arterial stiffness can damage the cells in the brain, which can result in depression and cognitive impairment. And as I said, inflammation also increases a person's risk of depression. And also health impairments. So people with medical diseases or cardiovascular disease might experience social withdrawal, so not participate in social activities as much. They might have limited mobility and reduce the amount of exercise they do, and they might experience pain, which also can increase the risk of depression. So as you can see from all these different health behaviors and biological interactions, the relationship between depression and cardiovascular disease is quite complex. In terms of the lived experience after a heart event, there's quite a few studies demonstrating how patients after a heart event experience increased anxiety, increased worry, and increased mental health worries. And here are some quotes that have been taken from a qualitative study which demonstrates this experience. And the reason why I like these quotes is because I really think they highlight the change in emotions people experience after a heart event. They're really worried about the future. Things that they used to take for granted in the past are now something that they worry about. And that unknown about what's going to happen demonstrates that the increased likelihood of patients experiencing depression or mental health issues. In terms of secondary prevention and cardiac rehab, there are recommendations about mental health screening and including discussions about mental health as part of the cardiac rehab process. So this shows that, you know, there is evidence that it's important to screen for and then refer patients on to seek mental health counselling or additional support if they do screen positive for depression or anxiety. And within the standardised program content for cardiac rehab, we have a number of recommendations for screening, but also having education about the signs and symptoms for depression, having conversations with patients about what the emotional response after a heart event is and how they and the things that they can do to improve their mental health. However, while we have these recommendations, we don't actually know how many cardiac rehabilitation programs are actually conducting screening for mental health screening, as well as adhering to these guidelines. Sorry, my slides have, some of them have timers on them. So in order to better understand this, as part of my work with Solve CHD, we developed a 31-item survey that assessed cardiac rehab practitioners' attitudes and practices around psychosocial well-being. We also measured some other things, which I'm not going to report too much today. But yeah, we developed this survey and shared it around through ACRA and Solve CHD to see the practices that are being done in current cardiac rehab programs across Australia. And we got representation from about 98 cardiac rehab practitioners. And what we found is that what's really promising is about 93%, 94% of practitioners routinely screen for psychosocial wellbeing within cardiac rehab. So it demonstrates that a number of people are meeting this requirement. However, most people are screening only at initial assessment. So that means when people come into cardiac rehab after a heart event, they're screened for their mental health, for example, depression or anxiety then. And then the rest of the cardiac rehab program goes on, and only about 47 to 50% of people are being screened at the end of their cardiac rehab program. So currently, while majority of people are screening, we don't know if cardiac rehab is improving people's mental health during the course of the programs. So that's something we can work on to improve. There are a range of different screening tools that are used, and we know one other thing that we measured is that most cardiac rehab practitioners believe that mental health wellbeing plays an important role in recovery after a heart event. However, their knowledge and confidence around providing mental health advice or discussing mental health concerns with patients is moderate. So that's something that we can improve with training. In terms of barriers to screening for or discussing psychosocial and mental health well-being within cardiac rehab, we know that there are time constraints. As I said, knowledge is a bit of a barrier, so maybe we can train or have more awareness of the importance of mental health. Some people feel like it's not 100% part of their job. They're not trained in mental health wellbeing. They're not a psychologist, so they feel like maybe it might be a bit of a barrier to talking about these things with their patients. And sometimes there are patient factors, like a patient can be too ill or mental health might not be a priority for them. And as with a lot of things, there are cultural language barriers that can sometimes prevent people from discussing mental health wellbeing. Now, next up, I'm going to go a bit of a different side of brain health and talk about cognitive health. And this is something that's not quite as well addressed in the role of the recovery after a heart event. So cognitive decline occurs when naturally as people get older. So we have this graph on the screen that just describes that cognition sort of remains stable in one's early and midlife and then slowly naturally declines. But we have this difference between natural cognitive decline and a clinical cognitive impairment, like mild cognitive impairment and dementia. And that's described by the dotted line. So somewhere in midlife, someone's path and cognitive decline changes from the natural normal declines that we see to a more clinical cognitive impairment. And this includes problems with memory, attention, and problem solving. And when someone develops mild cognitive impairment and dementia, really impacts their ability to take out day-to-day tasks and look after themselves. One of the problems in today's society, much like we have a rising number of people who are getting to older ages, which is a great thing, we also have a rising number of people who are then living with dementia. And the problem with this is we have no current effective treatments for dementia or Alzheimer's disease. So we really need to target ways that we can prevent this from occurring. And just like mental health, cognitive health has that bidirectional relationship with cardiovascular health. So that means people with cardiovascular health have an increased risk of cognitive impairment and developing dementia later in life. But then people with cognitive impairment also have an increased risk of developing cardiovascular complications. So again, it's one of those really complex relationships. Here, I've just got a slide that's demonstrating there are different types of dementia. So we have the most common type, Alzheimer's disease, but we have frontotemporal dementia, which is less common, Lewy body dementia, and what's more common in a cardiovascular population is vascular dementia. And all these, while they have slight differences, they all present with similar cognitive impairment and impaired memory, problem solving, and attention deficits. So as I said, cardiovascular disease is a risk factor for cognitive decline and dementia. And something that we still need to do a bit more research to really understand is, what's the role of cognition in the secondary prevention of cardiovascular disease? Some research shows in a recent review of the literature from 2020 that from 9 to 85% of cardiovascular people who survived a heart event go on to have some form of cognitive impairment. And this is really concerning because, as we said about how mental health can impair someone's ability to participate in secondary prevention behaviours like eating well or looking after themselves and exercising, cognitive impairment has the same relationship there. So mental health and cognition are really important in the recovery after a heart event, because we know that poor cognition and mental ill health reduce participants' likelihood of attending cardiac rehab. And as I'm sure many of us are aware, cardiac rehab is really important in the recovery after a heart event, as it reduces the risk of secondary events and increases patients' quality of life. Poor mental health and cognitive impairment reduce the engagement with secondary prevention behaviours. So people with cognitive impairment or depression are less likely to eat a healthful diet, are less likely to participate in exercise, might be more socially withdrawn, less likely to participate in important peer support activities. And this results in worse outcomes for these patients. However, it's not all bad news. We know that the components of cardiac rehab have been found to not only improve cardiovascular risk factors, but they also improve cognition and mental health. So lifestyle, so things like exercise and diet, play a really important role in reducing the risk of cardiovascular disease and secondary events after a heart event. They increase overall, they reduce the risk of overall mortality. But more recent research shows that both diet and physical activity are also foundational treatments for depression. So that means the healthful behaviours that you take part in cardiac rehab also reduce a person's risk of developing major depressive disorder. And researchers from the team at the Food and Mood Centre at Deakin developed the world's first clinical guidelines for the use of lifestyle-based mental health care for major depressive disorder. While we don't have similar guidelines for cognition, many of the same lifestyle behaviours, research is starting to demonstrate that they reduce the risk of developing cognitive decline and dementia. And this is a lot of the research that I focused on in my PhD, looking at how different dietary patterns like the Mediterranean diet are related to reducing cognitive decline through those cardiometabolic pathways. There are some current options, so things that you can do to, I guess, improve your mental health, sorry about these slides again, is that through the Food and Mood Centre, we have the Food and Mood Academy, who have developed a free online course about how diet is related to mood and the risk of depression. So you can partake in this free online course. We also, they also offer a online course that is a paid course for clinicians that would like to get a bit more information about the relationship between diet and mental health outcomes. And for those of you who are interested in following on with our research, you can join Solve CHD, and you can scan the QR code, or you can, I guess, contact me via my email, which was on the slide here. and I'm happy to take any questions. And I will share back to you as host.
Awesome. Thank you so much for that. Let me reclaim host.
Yeah,
I'm the host now. Good stuff. I'm happy with that. Thank you so much for that. I really appreciate it. I guess I just want to ask a couple questions. There's actually a couple other people I've got text messages from. In terms of, in your opinion, seeing patients, is there any significant things that you change in the program if, do you start to screen for cognitive impairment, and if they start to, is there any type of specific questionnaire, and if they kind of tip or that they move past that, is there cardiac rehab a little bit different, or, how do you go kind of about that? What's your recommendation?
I think with cognitive impairment, it's a bit tricky, and I think there are screening tools that you can use and that are available. Stuff like the mini mental state exam, which is a short screening tool for cognitive impairment and the risk of mild cognitive impairment. In terms of, I guess, the ability and how that might influence someone's cardiac rehab participation, it might impact their ability to remember things that they've learned in classes. So having handouts or things that they can take home with them might help. If you do screen and they do screen positive, it's really important, obviously, that goes to their GP or general practitioner so that they can get additional care there. So I guess having that communication with their sort of whole care team, so their general practitioner as well as their cardiologist, knowing what's going on and that you've noticed that their cognition might be a bit impaired. And then in terms of, I guess, ways that you can sort of alter the program, it might be including family members if possible, so that can help with the memory and reinforcement that they've learned, and the attention. So it's a bit, it makes it a bit tricky, but usually if they're well enough to come to cardiac rehab, their cognition is not as impaired as someone who might not come at all. So it's, again, that following that screening before people end up in cardiac rehab as well, and being able to mitigate that risk for further cognitive decline by encouraging them to exercise and eat well and do all the cardiac rehab practices that are important there as well.
Thank you for that. I guess a couple other questions. So one other question I've got is, do you think that we should be screening for this in our cardiac rehab patients, or should we only be for those perhaps that we feel that we have doubts about, or should it just be a standard screening for all patients? What's your thoughts on that?
I guess I think we still need a bit more research to know the numbers of people that are coming into cardiac rehab that might have this. From that study that was done, a systematic review, it was between 8 to 85% of patients have some sort of cognitive impairment. So if in real life it is closer to that 85%, then we'd want to be screening everybody. If it's more less likely, then it's probably less needed to screen everybody, and maybe just screen people that might come up with a bit of the risk factors, or might seem to be a bit of concern to the practitioners. In my opinion, I think it wouldn't hurt to include an additional screening measure, but I understand there's a lot of screening measures that people already do. So it's, again, that balance between time and what you can and can't include in the time you have with your patient.
Cool. And I guess one other one, I guess we know some of the primary prevention, it's kind of works both ways, right? Doing the right thing, I guess, with exercise and all those type of things can help with cognition from a primary prevention, and obviously now also secondary prevention as well through cardiac rehab. What's the biggest driver in some of the data or research so far? Is it the exercise improvements and improvements in cardiorespiratory fitness that drive improvements in cognitive function? Is it weight loss? Is it something else? I mean, being an exercise background myself, I'm going to assume it's the exercise improvements and probably resistance training as well.
I don't, well, I have a background in more nutrition and dietetics, so I'm not across all the literature. And I would say in terms of mental health, I think exercise has a stronger evidence background for the role of improving mental health than diet, but that might be the number of clinical trials. I think lifestyle in general together would probably have the strongest. One thing that I think is really important with mental health and we don't have the data for cognition, but I imagine it would be quite similar, is that the benefits we see for mental health and cognition in terms of dietary change are regardless of weight loss. So if you change your behaviors, particularly around diet, we see improved mental health outcomes regardless of whether a patient has lost weight. So if you end up eating more, healthful foods like fruits and vegetables and reducing the number of unhealthful foods, regardless of whether that has reduced someone's weight, we see a mental health benefit. And I think that's really, I guess, important and promising in terms of their mental health outcomes, because weight loss can be a hard target for some people. So, changing your behavior can have a positive benefit without, always resulting in weight loss.
I guess, look, it's interesting. It's a very important field. There's a lot more research in this area. I know in AF that they're looking at some type of cognitive impairments as well as a result of atrial fibrillation in the long term. So it is, a massive area. I guess peer support perhaps, could help mitigate some of the symptoms of I guess cognitive decline in this type of cohort. What do you think?
Yeah, well, that's one of the risk factors. So social withdrawal is a risk factor for dementia and Alzheimer's disease. So having peer support and peer support programs as well would in turn reduce risk of poorer mental health as well as cognitive decline in the future. So it is a positive thing to be offering our patients the ability to connect with one another. And peer support is, I'm conducting some research at the moment looking at patient experiences of cardiac rehab, looking at qualitative studies, and peer support is by far, I think, the thing that patients enjoy the most out of the program. So that connection that they've got with other fellow patients who've had a similar lived experience.
Well, I can't get a better endorsement than that. So I'm not even paying you for the endorsement. I think I should be. So look, thank you so much, Dr. Sarah Gauci. It was a pleasure. This will be going on our socials, our YouTube channel, and our next newsletter to promote to our consumer network, but also our clinicians across the country. So there's no doubt, I'm sure you're probably going to get some questions later on down the track for some people who want to engage. So I hope that's not an issue, especially from some of the cardiac rehab clinicians across the country. We probably want to ask some questions around some of your very, very important research and your background. So on behalf of Heart Support Australia, thank you again. We really do appreciate it, especially on such late notice. So I definitely do owe you something. And when I see you next, I think we can work something out. So thank you again. And I hope everyone enjoyed this month's edition of Heart Support Connect. And we'll keep in touch around future sessions that are coming up online for this year and next. So thank you again and have a nice night.
Bye. Thanks for having me.
Take care, Sarah. Pleasure. Thank you.